Hi, my name's Rachel Johnson. I'm a clinical psychologist working with children and families. I've been working in the sector for 12 years, and during that time I've worked in the NHS, education, and for county councils in the voluntary sector. So I've got a lot of experience across all different sorts of sectors. Although when I finished my doctorate in clinical psychology, I initially went into working into the NHS. While I was working there, I just saw a lot of gaps that were happening between the different fields. So a child would come in and be having difficulties at school and at home. The academic difficulties they were having, so they were struggling with reading, they were struggling with behaviour in the classroom. It was being passed off to educational psychology. Parenting difficulties were often going to parent support workers. And then the individual work with the child might be carried out by myself in a clinic room. And I started to get quite frustrated by all of that. So what I really wanted to do, I came out of the NHS a year ago to work solely within independent practice. And the goal of that is to fill in those gaps. So before doing my clinical psychology doctorate, I worked for 5 years at a specialist school, and I got a lot of experience within the classroom and assessing children for educational difficulties. So on one side, my work involves a lot of educational assessment. I specialise in dyslexia, looking at different cognitive profiles, what's going on for children in terms of their thinking skills. But also, because I've got the clinical training, I work with the emotional and behavioural impact of that, the effects on the family, what's happening for the parents, and trying to piece it all together to give a really coherent source of support for a family. One of the things that I think I do really differently from other professionals and from other services is that I do try and work across home and school, nursery, all the different settings that are important to a child. And that's proved quite a successful approach, and a lot of families have come back to me and commented specifically on that. The reason that I really enjoy working with children and families and working in the clinical and educational psychology fields is that it's such a rewarding job. So families are coming to you at a time when not only the child's distressed, but the parents, everything feels up in the air. It's really hard for everybody to contain what's going on. And to come into a family at that point and see what's happening for them and be able to offer strategies, support, emotional containment for the parents and the child, it's so rewarding. So although it can be a hard job, you're going in when things are very distressing for a family, it's just wonderful to see how fast people come along and the changes that are made. And I can't think of anything that would be more rewarding than seeing that.